This is Dr. Torrey with RookieDoctor.com. Here's another quick tip that we're going to go over that's regarding your sign out. Basically, when you hand off your patients from yourself to one of your colleagues, either if you're a med student and you're handing off to another med student as you change a rotation, or you're handing off to an intern that's going to be on call for the night, if you're a resident signing out to another resident, etc. Okay, this is an important tip where when you're signing out, you should sign out potential problems and their suggested solutions. This does a lot of people a lot of good. Okay, it will. So let's start with your patient. If you have, I mean, you know your patient better than the person you're signing out to, right? So, that being the case, you can anticipate problems that they might have and the best solution as tailored to that particular patient. Now, it's not to sign out a potential problem and the suggested solution is not to take away from the autonomy or the situation that the intern on call at night finds themselves in. Uh, it's a suggested solution. It's a potential problem. So these are, if you encounter this, it might be this. So this might want to be one of your first thoughts. Okay, so that so the first person it benefits is the patient themselves, right? So uh, it can prevent a whole monster workup for something small. If a patient has a headache, you might have a colleague of yours that might do $1 million workup and start down the role of head CTs and things like that when they're completely not indicated. If you know that your patient just had a lumbar puncture, well, maybe just do a quick physical exam and assess them, and maybe it's just Tylenol, maybe it's just a headache, maybe it's a normal thing that you expect, or maybe you just started them on nitro and they're going to get a headache. So if you you can anticipate what's coming, you can prevent the patient from having $1 million workup, okay, and prevent them from going down a cascade that's potentially harmful, especially if a study involves contrast or God forbid, something even more invasive. So it benefits the patient. It benefits your colleague by helping them and guiding them through through the decision tree, so that they're not in some sort of swirl, going through the chart and looking through things more in depth than they have to when the solution might be pretty obvious if they just had a little more information. The other person it helps is the nurse. The nurse, a lot of the nurses that you encounter, they have an idea of what's going on. They know their patient. They know their patient probably even better than you because they're in the room more. Okay, so although they may not know all of the same medical knowledge or the plan that the attending discussed earlier in the day, it's still their bedside judgment is very important, and it can be frustrating for a nurse to watch a med student or an intern or a resident start going down this path that's just not appropriate. Okay, so if you can guide the path by starting out with what the potential problem is, what the potential solutions are, you can save a lot of grief for the nurse too. And now another person that benefits is you. Okay, you benefit because the next day when you come in, the ball may have already started rolling on some of the things that you would have wanted to have done. Okay, and it can get your patient closer to discharge and some of your work done a little earlier, and anticipated things like labs or studies or what have you. Okay, or even just discussions with the patient, like this is what you should anticipate happening next, and next. Okay, so all of that stuff, it benefits the person on call, it benefits the patient, benefits the nurse, it benefits you, and it benefits the hospital, because the quicker the patient gets to a point where they're able to go home safely, and go home better than when they got there, the better it is for the hospital. So everyone benefits. It's win-win. It takes you 30 seconds. Sign out potential problems and their suggested solutions. Important tip. Okay, now, as mentioned in the other tips, my most important, number one, primo secret tip is at internship-tips.com. internship-tips.com. Internship.com. That's where a mentor gave me a single piece of advice that completely turned my career around, and I recommend you watch that free video and apply it. Okay? So go there now. Internship-tips.com.